Restraint use in the healthcare setting. This is Melody Routley, Nursing Professional Development Specialist for the Kaiser Permanente Northwest Regional Hospitals and the CNA2 educator. Let's discuss what a restraint is. A restraint is a manual method with the intent to immobilize or reduce the patient's ability to move or have access to their body. So is a limb restraint a restraint? Yes, a limb restraint is a restraint. Is side rails times 2 a restraint? No, side rails times 2 is not a restraint. What if you had side rails, all 4 side rails up with seizure pads on them? Is that a restraint? No, that is not a restraint. What if you had a patient in a posy bed, enclosure bed? Is that a restraint? No. Yes, it is a restraint. What about a patient who is in handcuffs from the law enforcement folks? Is that a restraint? That's a tricky one. That is not a medical restraint. That is a law enforcement restraint, so therefore it is not one of our restraints. What about a knee immobilizer? A knee immobilizer, do you think that is a restraint or not a restraint? No, that is definitely not a restraint. So keep in mind that restraints have the intent to immobilize or reduce the patient's ability to move or have access to their body. And restraints are solely based on the patient's behavior, the type of restraint. So you can see any restraint on any unit. We have 2 different types of restraint, non-behavioral and behavioral. The non-behavioral restraints is for our non-violent patients. Those are our pickers and our pullers. The behavior restraints are for our violent patients. Those are our hitters and our kickers. So if you had somebody who had the same situation, let's say that we have an elderly man come in because he fell and broke his hip. And if this patient is just picking and pulling on his lines and drains, his Foley catheter and his IV tubing, and we've tried everything else we can think of to maintain those lines and drains, and we had to put wrist restraints on that patient, those wrist restraints would be a non-behavioral restraint. If we have that same man, that same fractured hip gentleman, and he came in and he was hitting and kicking and trying to harm himself or others, and we had to put wrist restraints on him, those wrist restraints would be behavioral restraints for the violent behavior. Keep in mind that restraints are based on the patient's behavior, and all type of restraints can be seen on any unit. So I need to ask you, what type of restraint is this? Do you think this restraint is non-behavioral or behavioral? If you said it depends or it could be both, then you're correct. This is a soft wrist restraint, and this wrist restraint can be either non-behavioral or behavioral based on what the patient's behaviors are. So if this particular patient is hitting and kicking, then these restraints are behavioral. If this patient is picking and pulling, then this restraint is non-behavioral. What is your role with the patient in restraints? CNA2s need to document the care that you provide, and there's 2 different restraint flow sheets to document your care. Additionally, if you're signed to be a patient safety assistant or a PSA, you'll have additional PSA documentation to complete as well. Let's look at our non-behavioral restraint flow sheet. You see the same flow sheet as the nurse, but that doesn't mean that you document it in every single role. As a matter of fact, your documentation is limited to the restraint monitoring at least every 2 hours section. So you're documenting in this section here listed in red. So you might be checking the patient's circulation, you might be giving them fluids or checking to make sure they need to go to the bathroom. That's where you're going to document. Similar to the behavioral restraint flow sheet. The behavior restraint flow sheet shown here is one that you'll see is the same as what the RN sees as well. So your particular documentation is going to be limited to the restraint monitoring at least every 15-minute section, as well as the restraint monitoring every 2 hours section. Always use the least restrictive method of restraining a patient. You never want to start with the most restrictive and work back. Always start with the least restrictive. So that might be trying a mitt first. Do you think if the mitt is going to be enough, then that is the least restrictive and that's the one that we're going to try. If that's not working and then they're still pulling on their Foley catheter, then you might want to try a freedom splint or a soft wrist restraint. You always want to start with the least restrictive and work up. Remove the restraints at least every 2 hours. This is important to do range of motion exercises and to check their circulation. If the patient's in behavioral restraint, the circulation checks need to be done more frequently. Removing the restraints to do range of motion in ADLs is not considered a trial release. We don't do trial releases anymore. We don't take restraints off to see if the patient's ready to be out of restraints. As soon as the patient meets criteria for removing the restraints, then we're going to remove the restraints. If we need to put the restraints back on because the behavior continues, then we start the whole process over and get a new order for that. And the nurses would be calling the physician and getting that order. Be sure that your restraints never completely restrict the patient from moving. You don't want to restrain the patient completely restricting their movement, only until the therapy is achieved or they're no longer able to hurt themselves or others. Restraints should be secured to the part of the bed or chair that moves with the patient. You want to secure the restraints to the patient's bed frame, because the bed frame moves up and down with the patient. You don't want to secure restraints to the side rails because the side rails don't move with the patient. Safety first. Always keep in mind that the restraints that you're using are very dangerous and can potentially harm our patients, emotionally, psychologically, and physically. We never easily go into restraints. There is a lot of thought and considerations before we place restraints on a patient. That being said, you never want to position a patient in restraints face down or any other positions that may restrict their ability to breathe. This includes morbidly obese patients laying flat on their back. Those patients can't lay flat on their back because the weight of their own chest can restrict their ability to breathe. Never position a patient's arms across their neck and restrain them that way. That could potentially cause patients to not be able to breathe well. Don't put towels or linens over a patient's face. Limb restraint should never be tied. We have a quick release buckle that we use. You have a restraint training post-test that needs to be turned into me that includes a demonstration of application of the restraints and the removal of the restraints. So please see me to make an appointment for that.